In our screening exam, to test coordination, we use finger to nose, repeated movements, and the heel to shin test. Coordination requires integration of sensory feedback with motor output. This integration occurs mainly at the level of the cerebellum. For the finger to nose test, hold your finger out about an arm's length in front of the patient. Ask the patient to touch your finger with their index finger, and then touch their nose. Watch for accuracy and smoothness. Make sure the patient extends their arm all of the way. To test repeated movements, ask patient to alternate between patting palm and dorsum of one hand on the palm of the opposite hand. Demonstrate for the patient. Or you may ask the patient to open and close hand on one hand at a time. For the heel to shin test, while the patient is sitting or lying down, ask the patient to place their heel on their knee and run it up and down the sharp part of their shin. Watch for accuracy and smoothness of movement.